think everything should be like centered around relationship. Penitentiary or BC correction staff, emergency workers, psychiatric teams. If you go into that, you have to be willing to enter into relationship. Every patient I see, I'm entering into some sort of relationship with, because that makes me see them as a person and go that extra mile to get them reconnected or come up with that feasible plan that's going to work for them. And if you don't, I think it just gets people further and further into either their addiction or their criminal behavior. And that doesn't mean losing your boundaries as a professional. But I think if you go into it with the idea that you're entering into a relationship, you're going to provide better care. That's my way of putting that energy into the world, that if my brother were to go into care, that would ripple out to him.
So you as a hospital employee and worker, whether you're a receptionist, a psychiatrist, or a nurse or a social worker, you really do have a huge impact on the experience. To be treated with some respect and understanding that I know my daughter better than they ever could, that my intent is to help her get to a better place with their assistance. And I want them to know that if they treat us with a little kindness, especially the ill loved one, and compassion and empathy and respect, that can make a huge difference in the outcomes and the relationship that they can build with the patient.
Family members want to work together with healthcare professionals. We want to be really involved. And I also think that what they decide to do for that person, it really does need to line up with what the family is capable of doing at home, because giving someone a treatment plan that just isn't feasible to continue, it's kind of useless.
When you meet somebody for the first time, we're quite good at like the medical, the Western part of it. But when you get to know somebody, you can actually access their emotional health and their mental health and their spiritual health. And your job is to take all that knowledge that we've learned and synthesize it and offer what you can to that person and that family in front of you, and use that power for them, not over them.
I want people to know that their loved one is worth their time and effort to stay connected to. I was advised to seek a no contact order, and counselors advised me to set the boundaries. What you need to know is understand what you yourself can or cannot live with. And knowing yourself is what will help you find the right answers.
There's a limit to what you can control around you, but at least you can try to, create the support groups that you have around yourself, the people that you are close to, and the way that you interact with them. That's all within my control. And that's very important to me. And it helps me feel like, I'm not just like a little lost fish in a big sea. Like, there are things that ground me.
Yeah, I used a lot of free resources. I mean, I had counselors from the care team, and I went to Pathways, who offers all its services for free to families. And I provide support. And every time I teach a course of 8 weeks, 12 weeks, I learn more. And so if you can give, you can get. And then join the fight for acceptance, advocate with our governments for better treatment and fairer treatment of our loved ones so that the stigma isn't there. We need community because you cannot be isolated. So I've joined support groups, especially on the addiction side, because that was so much harder because the stigma is so much greater. Surround yourself with the people who will support and love you and your loved one.
We're all on a separate journey. We're all connected, but we're all on our own journey. And you can cause a lot of friction if we try to make other people fit into our journey. And I think relationship also with mental health and substance use and incarceration needs to extend not only to like the individuals working in the system, but there needs to be trust in like that there's relationship with the system and the policies itself, because it kind of extends more than just like the individual silos of a person. We know that we need the entire community to make everything work.
Now I found the right resources for psychosis and the right types of social workers that work with my family and me. It's asking for help and not doing things on your own, even though you feel very alone. It takes time and it takes a lot of patience and it's hard, but there are things out there that can support you, and there are people out there that you can relate to. So definitely don't be afraid to ask for help. Don't be afraid to open up to people. It just might take more than one try.